I'm experiencing a strong sense of urgency now because the consequences of not doing the operation quite quickly are lifetime blindness. It's not like someone developing a cataract when they're aged 60 and then if nothing is done for 5 years, then they can still operate and restore vision. It's different at this young age. This is a critical developmental stage. 5 months old. This child was born with bilateral cataracts. The parts of the brain that process visual information is not developed, and unless urgent action is taken now to treat the cataracts, the window of time will close and then the child will never see. And so I would be extremely grateful for any support that you can provide, because it will be absolutely life-changing. It will change absolutely everything for this child for their entire life. Just think about what a difference it would make if you were never able to see and blind for your whole life versus normal vision, normal life. Change everything.
Yes, hello everyone, you are welcome again to this video, and I'm very grateful again to be part of this video. We have been moving on with our camp that is being run between our visitor, Sean Robert, and also together with us here on ground to see that we can expand the service to the people. So today we have been able to do some screening camp, but we have seen multiple cases, and we are sharing out some information where we can be of help for those of us who be on this platform. So currently in our screening, we came across a 5-month-old boy. He's called Mathew. Has a challenge with the eyes, and to our examination, we have found out that he has what we call congenital cataract. Yes, he's born with this cataract and really needs an urgent cataract surgery. Otherwise, if he doesn't get the urgent cataract surgery, will be at a risk of developing what we call amblyopia. And amblyopia means it's a lazy eye. It means it is okay when you look at it in structure, but it cannot be able to function because it has not got enough development. And we know that in the development of the eye, the child's eye develops up to 2 years, so it's just 5 months. So doing a cataract surgery at this level is much, much better. But before we go ahead, let me welcome the mother to tell us how did she come to know that the child has a problem.
I'm called Achan Kevin.
Where you come from?
From Soroti. I came to know this through some people, because for me this is my firstborn. I've never got any child. This one I got through some people. People kept telling me that child, the eyes are normal. I said, I don't know. They said, have you ever seen this thing in his eyes? I said, I've been seeing that thing there. It is light blue. Sometimes it looks like a whitey. I said, let me go to the hospital. Now we discover that it is cataract.
Yes, of course. She also got to realize this problem from the neighborhood, the people who have kept on seeing, because he's the firstborn. You know, when you have gotten a child who is you're still having a firstborn, sometimes we keep learning along the way. So now this child ideally currently will need what we call a cataract surgery, so that we can be able to have the surgery done as early as possible for better, more developments, so that the child can live a better life. You never know, this could be maybe a doctor who will be also seeing eyes for people. So ideally, that's what we are looking forward. And we are hoping to have a lot of collaborations and different parties to see that the child's eye surgery is being supported, to see that he can be able to get the cataract surgery any time, because we know as a family it becomes very challenging to raise quickly the money for surgery, because in this case we are looking as time factor, because we don't want the child to develop amblyopia and lose a sight in the future. So we are going to have collaboration, and if you're watching us and you could do something more on this child, yes, can be able to get the cataract surgery as early as possible, so that they can be able to save the